Hello there, it's Dr. Ominde again. We're going to discuss the blood vessels of the thigh and popliteal region. Okay. So when you're asked to write an essay on the blood vessels of the thigh, whichever vessel it is, so you need to be able to write an essay. So the femoral artery, what's the origin? It's a continuation of the external iliac artery deep at the mid-inguinal point. Okay, so that's between midpoint between anterior superior iliac spine and the pubic symphysis. Usually it's enclosed within the femoral sheath, in the lateral compartment of the femoral sheath, and later on it becomes the popliteal artery at the adductor hiatus. It has several proximal branches such as superficial epigastric artery, superficial circumflex iliac artery, and superficial external pudendal artery. Okay, so this is your femoral artery, external iliac, at common iliac, external iliac, internal iliac. At the mid-inguinal point, external iliac becomes femoral artery. So you have your superficial epigastric here, you have superficial circumflex iliac, and you have your external pudendal here. So those are the proximal branches. Then femoral artery comes down. It gives you three branches: your profunda femoris, your medial circumflex, and lateral circumflex. So this is your lateral circumflex, that's medial circumflex. So superficial epigastric artery crosses the inguinal ligament towards the umbilicus. It anastomosis with inferior epigastric artery, while the superficial circumflex iliac passes along the inguinal ligament towards the anterior superior iliac spine and anastomosis with deep circumflex iliac artery. Okay, so this superficial epigastric anastomosis with inferior epigastric and superficial circumflex iliac anastomosis with a deep circumflex iliac artery. Superficial external pudendal artery passes medially towards the external genitalia. What are the deep branches of femoral artery? Deep external pudendal artery. We have a descending genicular branch to the genicular anastomosis. Then we have the deep branches, profunda femoris, okay, that may give medial circumflex, lateral circumflex, and three perforating arteries. And we may also have a genicular branch from this deep femoral. Femoral artery also gives deep external pudendal, and this supplies the external genitalia. We have the descending genicular branch from the femoral artery that arises in the adductor canal, and it supplies the knee, this part of the genicular anastomosis, and it can also give a saphenous branch that will run together with the saphenous nerve. Profunda femoris is arises from the deep part of the femoral artery within the femoral triangle. It's actually the largest branch of the femoral artery. So it passes posterior to the adductor longus muscle. This profunda femoris usually gives off medial and lateral femoral circumflex arteries. Okay, it gives us medial and lateral circumflex, then also gives off three perforating arteries to the posterior compartment of the thigh, and itself terminates as the fourth perforating artery. The medial circumflex femoral comes directly off the femoral artery, or maybe from profunda femoris. It leaves the femoral triangle between the iliopsoas and pectineus muscle. What are the branches of medial circumflex femoral? There's an ascending branch. This anastomosis with inferior gluteal artery when you're discussing the trochanteric anastomosis. It has a transverse branch, and this transverse branch anastomosis with lateral femoral artery in the cruciate anastomosis. So medial circumflex femoral supplies the hip joint and the muscles in the upper thigh and gluteal region. Lateral circumflex femoral, on the other hand, also directly off femoral artery and passes laterally deep to rectus femoris and the sartorius muscle. So what are the branches? This one has three branches. Ascending branch that anastomoses with superior gluteal artery at the trochanteric anastomosis. Transverse branch anastomosing with medial circumflex artery at the cruciate anastomosis, and a descending branch that participates in the genicular anastomosis. So this lateral femoral circumflex supplies the hip joint muscles in the upper thigh gluteal region as well as the knee. So cruciate anastomosis usually is an anastomosis that ensures communication between internal iliac and femoral artery. Remember, femoral artery is from external iliac, so it ensures communication between the two. So it serves as a bypass for femoral or external iliac artery. So if there is occlusion within the femoral artery, you can have blood supply from the internal iliac if external iliac is affected. So what are the branches of the cruciate anastomosis? You have medial, transverse branches of medial and lateral circumflex femoral arteries. You have descending branch from inferior gluteal artery and an ascending branch from the first perforating artery. So those four, the way I've stated it, transverse branches from medial and lateral circumflex artery, descending branch from inferior gluteal, and ascending branch of first perforating. So that forms the crucifix, the cross, cruciate anastomosis. Then we also have obturator artery in the thigh. It arises from internal iliac and enters the thigh through what? The obturator canal. So usually, obturator artery is accompanied by anterior-posterior obturator nerve branches. So it usually divides into anterior and posterior branches of obturator artery and also gives an acetabular branch. Where is this acetabular branch located? In the ligamentum teres found at the fovea capitis at the head of the femur. Okay, remember the one that is the main blood supply to the head of femur in children. Then we go to popliteal artery. Popliteal artery is a continuation of femoral artery. Where does it begin? At the adductor hiatus. Then where does it end? Terminates at the inferior border of popliteus muscle, where it branches into two, an anterior tibial to the anterior compartment of the leg and posterior tibial that goes to the posterior compartment of the leg. So remember, popliteal artery is the most anterior structure in the popliteal fossa. It's near the bone. Okay. What are the branches of popliteal artery? It has 5 major branches: superolateral, superomedial genicular arteries, inferolateral, inferomedial genicular arteries, and the middle genicular artery. And all these participate in the genicular anastomosis together with descending branch of femoral artery, descending branch of lateral circumflex femoral, 2 recurrent branches of anterior tibial, and a circumflex branch from the peroneal artery. So we go to venous drainage of the lower limb. So how do you discuss venous drainage of the lower limb? We have the superficial and the deep. So if we ask you to write an essay on venous drainage of the lower limb, start by describing the superficial veins and then the deep veins. And remember, the 2 superficial and deep veins communicate via perforators. So you need all the 3 elements to function well for proper venous drainage. Superficial, drain to the deep vessels through the perforators. So if perforators do not work, you have problems, okay? So, great saphenous vein. Write notes on great saphenous vein. This vein usually drains the medial aspect of the dorsal venous arc. So, it is formed by the medial portion of dorsal venous arc and the medial marginal vein of the first toe. Then it will ascend a finger breadth anterior to the medial malleolar. A finger breadth anterior to the medial malleolar. Then at the medial aspect of the leg, it courses superiorly, then passes a hand's breadth posteromedial to the patella, a hand's breadth posteromedial to the patella, and then great saphenous vein empties into the femoral vein, where at the saphenous opening, the cribriform fascia around the femoral triangle, that's the saphenous opening, that is where the femoral great saphenous vein empties into the femoral vein. So great saphenous vein is superficial and is able to communicate with the deep veins via perforating veins, and this great saphenous vein is usually inconstant except above the ankle, finger's breadth anterior to the medial malleolar, and above the knee on the posteromedial aspect of the patella. So those are the landmarks, the places where you will constantly find the great saphenous vein in most of the population. Finger breadth anterior to the medial malleolar and a hand's breadth posteromedial to the patella. This is your great saphenous from the dorsal venous arc and the medial marginal vein of the great toe. Then it passes finger breadth anterior to the medial malleolar, and the medial aspect of the leg ascends superiorly, a hand's breadth posteromedial to the patella, then on the anteromedial aspect of the thigh to empty onto the femoral vein via the cribriform fascia. Okay, so this on the lateral aspect is your small saphenous vein. From the dorsal venous arc on the lateral aspect passes, in this case, posterior to the lateral malleolar for the small saphenous vein. Great saphenous was anterior, finger breadth anterior to the medial malleolar. Small saphenous vein is posterior to the lateral malleolar, then ascends on the posterior aspect of the leg. Then at the popliteal region, it pierces the fascia to empty into the popliteal vein. So the long or great saphenous vein is on the medial aspect, the small saphenous vein is on the lateral aspect of leg, then posteriorly into the popliteal vein. Lesser saphenous vein or small saphenous vein. Origin, lateral side of the dorsal venous arc. Passes posterior to the lateral malleolus. Passes superiorly at the posterior aspect of the calf, usually accompanies the sural nerve. It pierces fascia of the popliteal fossa, then drains into the popliteal vein at the saphenopopliteal junction between small saphenous vein and popliteal vein. So, the small saphenous vein usually has perforators that continue superiorly, so it drains into the deep veins. Okay, so the deep veins of the lower limb, those were superficial. The deep, we have the vena comitatus, the veins that accompany the deep arteries. Okay, so you have the anterior and posterior tibial veins. They unite to form popliteal vein within the popliteal fossa. Okay, and then the popliteal vein will, at the adductor hiatus, enter the adductor canal as femoral vein. Okay, then we also have communicating veins. So we have done the venous drainage of the lower limb. Then we go to the lymphatic drainage. So lymphatic drainage on the medial aspect will follow great saphenous vein. On the lateral aspect, the superficial lymphatics will follow small saphenous vein. So medial foot will ascend, follow the great saphenous vein, therefore they will end at the superficial linguinal lymph nodes. Remember, superficial linguinal lymph nodes are arranged in a T. You have horizontal group along the inguinal ligament and vertical group along the great saphenous vein. What do superficial linguinal nodes drain? They drain the anterior abdominal wall below the umbilicus. They drain the external genitalia, perineum, anal region, and the fundus of the uterus. Remember, anterior abdominal wall and the thorax. Anterior abdominal wall above umbilicus and the thoracic wall anteriorly drain onto the anterior group of axillary lymph nodes. But the anterior abdominal wall below the umbilicus drains onto superficial linguinal nodes. So superficial linguinal nodes will drain also the external genitalia, perineum, anal region, and fundus of the uterus. Then the lateral foot usually will drain following the lymphatics around the small venous saphenous vein, and these end up at the lymph nodes in the popliteal fossa. Then from there, they will ascend following femoral vein to the deep inguinal nodes. Remember, majority of the deep inguinal nodes are in the femoral canal, the Cloquet's node that drain the clitoris in females and the glans penis in male. They also receive lymphatics from femoral vein, which have come from lymphatics around the popliteal fossa, where the small saphenous vein and its lymphatics will drain. So superficial inguinal veins usually drain into deep inguinal nodes, which superficial inguinal nodes drain into deep, which drain to external iliac lymph nodes. So what are the important anastomosis in the thigh, which we have already discussed severally? We have the trochanteric and the cruciate anastomosis. Trochanteric is the main blood supply to the head of the femur in adults. So nutrient arteries pass along the femoral neck beneath the capsule. Those are the retinacular vessels. Which vessels form trochanteric anastomosis? Descending branch of superior gluteal, descending branch of inferior gluteal artery, ascending branch of medial circumflex femoral, ascending branch of lateral circumflex femoral. So those form trochanteric anastomosis. What forms cruciate anastomosis? Cruciate is located at the lesser trochanter of the femur. So together with trochanteric, they usually provide a connection between internal iliac and femoral. Both anastomosis ensure gluteal vessels are from internal iliac. Then femoral vessels are external iliac. So they ensure that communication. So if you have obstruction of external iliac, you can still get blood supply to your lower limb because internal iliac will communicate with the branches of femoral artery and supply the remaining part of the lower limb. So what are the branches of cruciate anastomosis? Descending branch of inferior gluteal, transverse branch of medial circumflex femoral, transverse branch of lateral circumflex femoral, and an ascending branch of first perforator from the profunda femoris. So you form a crucifix. The four will form a crucifix. Okay? So these are the retinacular branches. Okay? And you can appreciate that you have a ligamentum. This is your transverse acetabular ligament here. That's your acetabulum, this articular surface. And this is your blood supply from obturator artery through ligamentum teres piercing, entering the femoral head through the fovea capitis. Okay, thank you very much.